my name is Melissa Paguio. This is for week 2 of advanced health and physical assessment across the lifespan, neurological assessment. Let me go around the room. Just show the 4 corners. Can I have your name, please? MJ. I would like to ask for your consent for this video to be uploaded on YouTube for professor viewing and grading.
Yes.
Okay. So this week we begin with neurological assessment. It will include assessing the patient's level of consciousness, orientation, memory, attention. It also includes assessment of the cranial nerves, motor, and sensory. We begin. Can I have your name, please?
MJ.
MJ, can I have your date of birth?
12/16/1994.
Okay, so this part here can assess her level of consciousness, which is she's awake and alert. Her orientation, she knows her birthday, and she knows her name. Do you know where you are right now?
Yes.
Where are you?
Home.
Okay. So I would consider this alert and oriented times 4 up to name, place, date, and situation. The next assessment could be for memory. It could be asking her, you said your birthday was?
12/16/1994.
Okay, and then this can assess her short-term memory. Oh no, yeah, short-term memory, and then long-term memory. And then to assess her short-term memory, we can ask her, what did you have for breakfast today?
Rice.
Okay. As long as she remembers what she had this morning or any events during the day, this can consider assessing her short-term memory. Can I ask for you to repeat this? I'm gonna say a word and you repeat. You spell it backwards, okay? Can you? I'll say dream, and can you please say it backwards?
Say it
Or
backwards.
spell it backwards.
MAERD.
Okay. So this is assesses her attention. I will now start with assessing her cranial nerves. We will start with cranial nerve 1, which is her olfactory cranial nerve. This involves asking the patient to smell a familiar scent. It could be like coffee, it could be like lavender, cinnamon. We can ask her to cover one nostril and smell, and do the same on the other side. So for cranial nerve 2, which is optic, we can start by assessing her optic nerve. I'm gonna shine a light on your eye. And I'll be assessing for her the parts in her eye, the optic fundi. I just want you to look straight forward. And then do the other side. So for cranial nerve number 3, 4, and 6, which is oculomotor, tracheal, and abducens. It can be all done at almost at the same time. It's to assess for the extraocular motor and action of the eyes. I'm gonna ask her to, I'll just show you. I'm gonna ask you to follow my finger, okay? That assesses cranial nerve number 3, 4, and 6. For cranial nerve number 5, this is trigeminal. I would ask, because it has sensory and motor function, I will start with the motor. I'm gonna have to touch your face a little bit. I'm gonna ask you to take a bite when I touch your face. Okay, I'll put my hands on the temporal and the masseter muscle. Touch your teeth. Touch your teeth. For this one, you'll see you can assess if there's any asymmetry in the face, which could show if there's any damage on the cranial nerves. What else? Cranial nerve number 7 will be the it's the facial cranial nerve number 7 is the facial nerve. I would like to ask for the patient to frown or put her eyebrows up. Frown. Put your eyebrows up. Okay. Then also this you can see if there's any symmetry or asymmetry in the face, and that could show if there's any damage on the cranial nerve. Number 7. Number 8, it'll be for the ear. Is vestibulocochlear. We can start with the whisper test. I'm gonna say a word and or I'm gonna whisper a word. Just repeat after me, okay? I'm gonna have to cover your ear. And do that in a second. Okay. For the vestibulocochlear cranial nerve, we can also test for the Weber test, which can we use this tool for it. I'm gonna have to ask. I'm gonna have to put this on the top of your head. It'll tell me when if you hear like humming on both your ears. Okay. And this can be the Rhine test also, which is for bone conduction and air conduction. I'm gonna do this one. I'm gonna put it against your ear, and then tell me when you start. When you stop hearing the buzzing sound. Okay. It's like a high frequency sound. This is just checking for air conduction and bone conduction, which can be important in determining if they have sensory loss, or hearing loss. For cranial nerve 9, 10, and 12, which is the hypoglossal, the the vagus, the hypoglossal, and the glossopharyngeal. It relates to the throat and the tongue. So I'm going to just ask MJ, are you able to swallow? Can you do it for me? I'm going to ask you to open your mouth. I'm going to just check for any deviation in the tonsils, in the tongue. I'm going to just shine the light on you. Can you stick your tongue out for me? Okay, so that's cranial nerve number 9, 10, and 12. For cranial nerve number 11, spinal accessory, I'm just gonna ask the patient. I'm gonna stand behind you, and I'm gonna ask you to put your shoulders up. Put it down against force. Okay. So that's the spinal accessory cranial nerve number 11. So that concludes the cranial nerve assessment. Now we move on to assessing patients' motor skills. So I am gonna ask you to put your hands up for me. Okay. We're gonna see if there's any deviation, if the patient drifts, if the upper extremities drift. Against me. Should I put my hand down? Okay. Now we're gonna put the lower leg. Okay. I'm gonna put a little bit of space with your legs. I'm gonna try and open your legs, and you try to close up. Okay. The other side. Okay. Then for your feet also, I'm gonna have to touch your feet. I'm gonna try and push them down. I'm gonna try and push them down, you try and push them up. The other side, I'm gonna have to push them back. Okay. So we're gonna also assess her shoulders, her elbows, her joints. Are you able to raise your hand up and down? Okay. We're just testing for range of motion also. For your shoulder or your elbow, are you able to up, down? Against me? Or for your wrist against me, against me. Okay. And then I'm gonna do your fingers also. You have to try to open them. Okay. And then try and close them. Okay. What else? Okay. So now we can try her gait. See if she can stand up. See her balance. Stand up. Okay. You wanna close your eyes and see if she loses any balance. You wanna put your hands up. Okay. You see no drift. I'm gonna put your hand. It should go back up. Okay. And we don't lose any balance. Okay. And sit down. I'm gonna be testing her reflexes now. Would you mind putting your glossy part up to here. It's okay. We're gonna start with the brachioradialis reflex. I'm gonna put my hand here, and then we're gonna watch for any movement on the thumb. And then now we're gonna see the brachial reflex. And then now it's gonna be the triceps reflex to hit the behind on the elbow. And we can do it on the other side. And then now we can do the patellar reflex on the knee. Or below the knee. Check for movement, and then I'm gonna do the Achilles reflex also. So those are the reflexes. Now we're gonna check for sensation, any for pain, for texture, and temperature. I'm gonna ask her to see if she feels any sharp or dull pain. Okay, I'm gonna be using a Q-tip and a toothpick for the sharp part. Just say yes, okay, if you feel it. Yes. 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 Now we'll try the soft part of the Q-tip. Yes. 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 I think that's it. So those are assessments that are done for the neurological system that uses that we can check their orientation, their attention, memory, testing the cranial nerves, and motor and sensory function. Yeah, that's it. Thank you.